I'm a fellowship-trained breast surgical oncologist. I'm Dr. Amani Jambakar, and recently someone asked me, are isolated tumor cells in a sentinel lymph node when someone has a diagnosis of ductal carcinoma in situ significant? So for those of y'all who are new here, a sentinel lymph node is the first 1 to 3 lymph nodes that breast cancer would try to spread to if it were to spread outside the breast. DCIS, or ductal carcinoma in situ, is also known as stage 0 or pre-invasive cancer. And the reason is because there are abnormal cells which have lined the duct of the breast, meaning the tube which delivers milk out to the nipple, and these cells have not broken through the wall of the duct to become invasive or stage 1 breast cancer. Ductal carcinoma in situ, in theory, does not have the ability to spread because it hasn't broken through the wall of the duct. Those patients who do have sentinel lymph nodes, which have isolated tumor cells or micro or macro metastases to the lymph nodes, do have some component of it, by definition, which is invasive, meaning there could be 1 or 2 invasive cells which have broken through the wall of the duct and which have made their way to the lymph nodes. Sometimes, even when the final pathology comes back, the pathologist is not able to find the 1 or 2 cells which are invasive, and the report says that there's ductal carcinoma in situ, yet there are isolated tumor cells in the sentinel lymph node. Studies have shown that the prognosis is the same for patients with isolated tumor cells and DCIS as it would be for patients who have just DCIS and their lymph nodes are completely negative or clean and do not have any cancer cells at all. This is a meta-analysis which was published in 2022, which looked at how often patients may have invasive disease if they have ductal carcinoma in situ and how often it spreads to the sentinel lymph nodes. The study included over 44,000 patients and showed that isolated tumor cells did not mean that the breast cancer was more likely to come back in the breast or anywhere else in the body for patients with ductal carcinoma in situ. The study did also show that patients with estrogen receptor negative ductal carcinoma in situ, a lump that they could feel, tumor size greater than 2 centimeters, and grade 3 ductal carcinoma in situ were more likely to have invasive disease within that ductal carcinoma in situ.